Hi, this is Dr. Reed with the Family Doctor in Kapolei, Hawaii. Today I want to start a short series on the subject of diabetes, particularly type 2 diabetes. Diabetes is a disease in which the body is unable to properly regulate the level of sugar in the blood, the level of glucose. And the result of this is that you end up with high levels of glucose, and that high level of glucose causes damage to the insides of the blood vessels, causes damage to end organs such as the kidneys, damages the brain, damages the heart, basically damages everything, and much of that damage is irreversible. One of the big problems, of course, with diabetes is the typical diabetic does not have any symptoms. He feels fine. He comes into the office with his blood test results, and his doctor says to him, you know what, your sugar is starting to get a little high, we need to do something about it. And the patient says to himself, I don't know what he's talking about, I feel fine. Which is the problem, because when you've got something wrong with your stomach, or you've got something wrong with your lungs, you feel the symptoms. But when you've got diabetes, you feel nothing, and so the sense of urgency to get things changed is not there. But believe me, the problem is very real. And if it's left untreated, or if it's left to its own devices, diabetes will, as I say, damage the end organs. Ultimately, the kidneys will fail, and the patient will end up having to be on dialysis. Now, we all know people who have diabetes, and many people in Hawaii stricken with this, and so it's something that we need to take seriously. And over the next few weeks, I'll be talking about what goes into diabetes, how it works, what we can do about it, what you can do about it. There are components of it that are genetic, which you cannot change, but most of the components of diabetes are behavioral. Things like how much and what you eat, and how much exercise you're getting, what kind of exercise, and these are things that you can change. They're under your control. So I'll be starting to talk about that over the next few sessions, and I hope you join us to learn a little bit more about this disease that's very common and very widespread.